Hi, Dimitri. I'm Lindsay. I'm going to be the nurse practitioner taking care of you today.
Hello.
So I'm going to be doing an assessment of your hair, your skin, and your eyes. I'm going to be walking you through the examination and explaining everything that I'm doing. So if you have any questions, feel free to ask, okay?
Okay.
Okay. Is there anything you want to ask me before we start?
No.
Okay, great. So the first thing you want to do is just make sure that you're comfortable. You don't seem to be in any distress or discomfort. You're in relatively good posture. You don't seem to be guarding or in any pain. I would also be looking for any abnormal movements or twitching, which I don't see. I'm also looking at your overall hygiene. It seems to be good, and I don't see any or smell anything abnormal. I'm going to assess your mental status. So, what's your name?
Dimitri Ostro,
Okay. And where are we?
Connecticut.
Okay. And what do you have done today?
A physical.
Okay, great. And what's the date?
6/12/2015.
Okay. So this means that you're alert and oriented times 4. And now I'm going to assess your head. So first I'm just looking at your facial symmetry. It's nice and symmetric. And now I just want to feel your scalp. And I'm looking for any lesions or masses or any skull deformities or any pain with palpation. Do you have any pain?
No.
Okay. So I also don't see any infestations or feel any bulges or masses. So that's good. I'm also looking at the texture of your hair. It's nice and smooth and evenly distributed. So now I want to move on to your skin. Your complexion is appropriate for a Caucasian male. I'm looking for any lesions or scars or markings of any kind. This includes any macules, which are just little freckles. And I see a couple on your face and your shoulders. There were a few on your back. There's a couple on your arms and some on your legs. Okay. I don't see any suspicious nevi or moles. However, the papules and the plaques I'm noting on your elbows, both of them, your knees, and your shin, these are things that I would consider referring you to dermatology for. So is this causing you any problems or pain?
No.
Okay. All right. So the texture of your skin is nice and soft on both arms and your legs. I'm also going to check the temperature, and I do this by using the backs of my hands. So your skin is nice and warm. I'm also looking for signs of good hydration, so I'm just going to pinch your skin, and this is called a Turgor test. And the skin should just go right back to where it was, and it does. So there's no tinting, so you're well hydrated. I'm looking for any color changes in pigmentation, any cyanosis or bluish color, and or tightening of the skin. I don't see any of that, so that's good. I want to make sure I'm checking your feet for swelling. I don't see any, but while I'm down here, I'm going to check for capillary refill. And this checks for oxygen perfusion. Let me check this in both your toes and your fingers. So can you stick your hands out for me? Okay, great. So I'm just going to check it in all of your fingers. And what I'm looking for is for the color to rush back into the tips of your finger within 2 to 3 seconds. And your toes as well. And it does. That's normal. So now I'm done with that, so I'm just going to move on to the eye exam.
Okay.
Okay, so first I'm just inspecting the eyes. I'm noticing your lashes. I want to make sure those are pointing upward, and they are. There's no discharge or abnormal tearing. There's no ptosis or drooping of the eyelids, which is good. Your sclera are nice and white. I don't see broken blood vessels or discoloration. Next, I'm going to look at your conjunctiva. I'm going to look at the vulvar and the palpebral, so I'm going to just pull down. And if you could look up for me. Great. And now I'll just look down. Good. I'm just going to press on the bottom of your eye down. And if you could just open up and look side to side. That's great. And what I'm doing here is just checking the lacrimal sac. I'm just making sure that it's pale, pink, clean, there's no discharge, and that they're lubricated, which they are, so that's normal. Okay, so open your eyes for me. I'm looking at your irises. There is a clean line of demarcation. They're light brown, uniform in color bilaterally, so that's good. I'm now looking at your pupils. They're symmetrical, equal and round. And so I'm going to use a little tool here to check the size. And it looks to be about a 5 right now, and that's normal. So now I want to check your reaction to light. Okay, so first I want to check direct response. And what that means is that when I shine the light into your pupil, it's going to constrict, okay? Good. Good. Perfect. Okay, so now I'm going to assess consensual response to light. And what that means is when I shine my light into your right eye or your left eye, the other eye will also constrict even though the light isn't being shined in it, okay? So I'm just going to block the light here. And I'm going to check. Perfect. Perfect. Okay. So you have direct and consensual response to light, and that's normal and good, okay? So now I want to check your extraocular movements. And this is going to check cranial nerves 3, 4, and 6, which are your ocular motor, your trocar, and abducens, okay? So what I want you to do is follow my finger. Just look at it with just your eyes. Don't move your head, okay? So you're going to follow my finger through the 6 cardinal fields of gaze, okay? And what I'm looking for here are any nystagmus at the extremes. And if you had a few of these, that would be okay. That would be normal. But I don't see any, so that's okay. So now I'm going to test the optic nerve, which is cranial nerve 2. And for that, I'm going to need my Snellen chart. And with this chart, you're going to be about 2 feet away. So what I want you to do is cover your right eye. Now, do you wear any glasses or contacts?
No.
Okay, good. So I want you to read the smallest line that you can read.
LTFPH.
Okay, and Ella?
LTFPH.
Okay, good. So you read the 20/20 on both eyes, which means you have perfect vision, okay? So what we're going to check next is the visual field. So I'm going to be standing right in front of you, and I'll be putting my arms behind you. So as soon as you see my hands, you let me know by saying now, okay? Okay.
Now. 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 Now.
Okay, so there's no need to assess any further because your visual fields are intact. So next I'm going to test for convergence, okay? I'm just going to have you look at my finger. Okay, so don't move your head, but just follow with your eyes, okay? Okay, good. So your eyes move towards your nose, and that's normal convergence. So now I'm going to check for accommodation. So what I want you to do is look at my finger. Okay, now look at the wall behind me, and back at my finger. Okay, great. So what happened is when you looked at my finger, your pupils constricted. When you looked at the wall, they dilated or widened. And when you look back at my finger, they constrict again. Okay, so that's a normal accommodation. So now I'm going to look at some more internal structures of the eye using my ophthalmoscope, okay? Just going to make sure this bad boy is set to 0. So first I'm going to be looking for any shadows. So this could be indicative of a glaucoma or something. So I'm just going to shine my light laterally. Okay. Now I'm just going to dim my light so I can get a little bit more internal. So now I'm going to be holding my scope with my right hand for your right eye and my left hand for my left eye, and for your left eye, okay? So I'm going to start by locating the red reflex. If you can just look straight forward at me, look at me. I'm going to be about 15-degree lateral angle away from you. And I do see the red reflex. And this is an orangish reflection in your eye when I shine the light. So I'm just going to hold my hand on your orbit to stabilize, and I'm going to be moving it, okay? Okay, I've located the optic disc. It's a creamy orangey yellowy color. I'm also looking at the retinal vessels. There's no torturism or twisting or abnormal pulsations or pathedema, which is inflammation of the optic disc. Keep open for me, sorry. Also, I see reflection coming from the fovus ventralis, which is in the center of the macula. That's normal. Okay. Now left hand, left eye. Sorry about that. All right. So I'm just going to start with my red reflex again. Open up and look at me, please. Look at me. Okay. Good. I see the red reflex. All right. Open up. All right. right, great. So same for the left. The left, so all of that looks good. I didn't see any shadows or, I'm sorry, or opacities or anything like that. So the one last thing, we're almost done. I'm sorry, I know that's right. Is I'm just gonna check for your visual acuity, okay?
Okay.
All right, so I'm just gonna shine the light right between your eyes and look at me. Okay, I need to get a reflection, so that's good. That concludes our visit.
Sweet, thanks.